For the latest on changes to Australia's vaccine rollout, including in particular AstraZeneca, I'm joined from Canberra now by the Health Minister, Mr Greg Hunt. Okay, Minister, there's been a lot of announcements in the past 24 hours. Where are we up to tonight?
So I think there are two fundamental things. Firstly, the review of the international data with relation to AstraZeneca, which says safe, effective and recommended for the over 50s, which is where we're at in our program at the moment. We're focusing on the over 70s and the over 80s, and then we'll move to the over 50s and over 60s. So that part of the program is unchanged. For the under 50s, the recommendation is that the preferred vaccine is Pfizer, and that's the other major development. We've worked over the last day and so to secure an additional 20 million Pfizer vaccines. We've signed a contract to do that, and that means Australia will have 40 million vaccines for Pfizer delivered this year on top of the AstraZeneca, and that's the capacity to make sure that we have 170 million vaccines with all the others, enough to vaccinate every Australian more than 3 times over. We keep going with the program, and above all else, we follow the medical advice, which is why we've got 0 cases in Australia today, and there are 800,000 cases around the world today. And so that medical advice has kept us safe, and that's what we're continuing to do.
Yeah, I think you've had a raw deal in terms of being blamed for the fact that you'd ordered and bought vaccines out of Europe that never arrived. These are AstraZeneca vaccinations. Obviously, we're making it now in Australia, but I think the brand has suffered a bit of damage. I'm interested to know, I've looked around the world, there's different thresholds for when AstraZeneca is recommended and not recommended. You've landed on 50 in Australia. I turned 50 a month ago, so I'm a bit interested. I'm right on that dividing line. Why is it 50 and not 60 like it is in some countries? What's the issue with that marking point?
Sure. So, of course, the UK has said 30, and some of the Eastern European countries have, at this stage, not to the best of my knowledge, made a change. Others have put different figures. Our medical advisors have looked at a very simple equation, and I think we have some of, if not the best, immunisation advisors in the world. And there are really 2 things that come together. The first is, as you get older, your risk of a possible side effect or clotting outcome decreases very, very significantly. Secondly, as you get older, your risk of complications from COVID, including death, increases dramatically. And on that basis, the clear advice was that out of an abundance of caution, they would set 50 as the age below which Pfizer was recommended, and above that, AstraZeneca is strongly endorsed and recommended as safe and effective, and that is a conservative estimate. Some have been critical that it's too conservative, but we accept that medical advice, and we've implemented it completely.
What happens if someone like me is 50 and I don't want AstraZeneca? Can I ask, but I want to be vaccinated, can I ask to have the Pfizer jab?
For this point in time, as we go through phase 1B and then 2A, the general practices will be providing the AstraZeneca vaccines. As we move further through the program, the states will have Pfizer vaccines, and as we move into the later stages with much higher supply of Pfizer, that 40 million doses, which has gone from 20 million, with the additional 20 million we've now purchased, to 40 million Pfizer, then the Pfizer will be more widely available later on in the year. Right now we're focusing on the priority groups with that, the under 50 health workers, the under 50 with immunocompromised, and those in residential aged care. So there is enough vaccine to provide very significant supplies for the entire adult population in Australia, both through Pfizer and through AstraZeneca. But we're encouraging everybody.
Greg Hunt, I've got to jump in there, though. But is that a yes or no? Is that a yes or no? Does the consumer of the vaccine have any say in the type they have?
So the answer is, if you go to a GP, they will have AstraZeneca. later on in the year, if somebody did not choose to take that up, then they will have other options available to them with the Pfizer. We do encourage, and Brendan Murphy and Paul Kelly were absolutely clear, the head of the Vaccines Task Force, the Chief Medical Officer of Australia. We want people to be vaccinated as early as possible because it protects them and it protects all other Australians.
All right, I just want to ask a question about Pfizer vis-a-vis AstraZeneca. I mean, Pfizer is an mRNA vaccine. AstraZeneca is the other type. It's viral vector vaccine. It's the one we make now in Australia via CSL. I'm told we don't have capacity in Australia to manufacture the mRNA vaccines. And if we don't, why not? And how quickly could we start it up, Greg Hunt?
Sure. So the world had never had an mRNA vaccine prior to the current Pfizer and one other, and so that did not exist as an option worldwide. We were able to have CSL refitted and reprofiled. It was a Herculean task. We have explored with them whether they could do mRNA, and the answer is that the time frame to do that would be a very considerable period. They're nevertheless considering it as part of a future option for Australia, and they're looking at how quickly they could do it. That's public. But their belief, and they are the ones who transformed their current plant to produce the viral vector vaccine, or the AstraZeneca one, is that it would take some considerable period of time. But they are looking at that option as a mid-term option to provide a whole-of-nation mRNA capability.
Well, Greg Hunt, well done on getting all those extra Pfizer doses overnight. That is a pretty massive win there for Australia. Thank you for your time tonight.
That's right. We always have to adapt, and that's how we've kept ourselves safe. We've secured more vaccines. There's enough for everybody, and we'll be able to vaccinate the nation. And there are changes, but equally we have that current security and we have the future security.
As I said, I think you're one of the best ministers in the government, so I am happier than anyone else that you were in the job and not someone else. Thank you, Greg Hunt.
Thanks very much.